So, welcome back to this podcast series on Lyme disease, Navigating Lyme Disease with Dr. Darin Ingels. This is part 2. If you haven't already listened to part 1, episode number 38, please go back and listen to that episode. That will give you a lot more background and information related to Lyme disease, and it'll help you kind of move into this part 2 or episode number 39, Lyme disease. And we're going to talk mainly about treatments today. You can download the PowerPoint that will kind of walk you through everything we're talking about. And I just want to let you know that in that PowerPoint, there is a lot more information about treatment than there is in this podcast. Treatment for Lyme disease could go into literally days of talking about it. And as you've probably learned a little bit in part 1 is that practitioners, depending on how they're trained, what their school of thought is, they all have different ideas sometimes about how long you have Lyme disease, if chronic Lyme disease even exists. And if you live in a country too where they don't even believe Lyme disease is a condition like Australia, then finding treatment protocols can be exhausting, can be frustrating, definitely confusing for patients. And so in this podcast, we're going to be talking about the most common treatments that Dr. Ingels uses and that he's found that helped his Lyme disease, as well as he's found in treating hundreds of other Lyme disease patients in his practice, as well as autoimmune patients, because as we well know, Lyme disease causes somewhat of an autoimmune condition within the body. And I really like this. I really like this podcast because we're not going to get super deep into the protocols and that kind of thing, because you really do need a physician to help you walk through this. If you do have Lyme disease, or let's say you haven't even been diagnosed and you need help with that. Self-diagnosing and self-treating is very difficult with a disease like this. But what I like about his protocols is that he's tried the other stuff and he's had the most improvement himself and in his patients with these protocols, and most of them are herbal. So we talk a lot about herbal medicine, and I think that sometimes because in conventional medicine we have antibiotics, and people think that that is like the best form of medicine, especially in infectious disease. But as we well know, we're starting to have a lot of problems with antibiotics in our community and in our societies and worldwide with antibiotic resistance. And when you start to see vector-borne infectious diseases like this that are not only acute in nature, but can also be chronic in nature, is that using antibiotics long-term can be very in a way detrimental to your health. So it's important to work with a physician on these things, but the PowerPoint will help give you a little bit more in depth about the different treatments and the good, the bad, the ugly about conventional treatments, as well as herbal treatments and some of the different reactions you can have with things, as well as some of the adjunct kind of autoimmune therapies that practitioners may be using. Dr. Darin Ingels does take patients, and he, as he says in this podcast, he takes patients from all over the world. He can do testing from pretty much anywhere based on the labs that he works with, and he can do long distance treatments and stuff with you. And it may get complicated depending on where you live and access to things, but I would highly recommend, if these podcasts are resonating with you and you want more help, is to contact him at his office, going to his website at dariningelsnd.com. There you can find all his practice locations. He has 2 in California, and he has 1 in Connecticut, which is helpful because, as we know, the Northeast is probably the biggest place in the United States where we see Lyme disease contracted. But or you can work with him virtually, pretty much from anywhere in the world. You can find the show notes for this podcast, as well as a link to the download at huntharvesthealth.com/podcast/Lyme disease 2. Let's talk a little bit about treatments. First, I want to talk about the conventional treatments. What is somebody who has an acute case, they've come in, they're now going to be treated? What would they be looking at in a conventional
Yeah,
Conventional model, what would they be looking at?
The conventional treatment for acute Lyme disease is either using doxycycline or amoxicillin. Typically for adults, it's doxycycline, and you use it up to, the typical dose is 21 days. What I find very interesting is the CDC recommendations 21 days of doxycycline, and whether you're well or not at the end of that time period, you're just done. That's just the guideline.
Yeah.
I think there have been other doctors, even in the conventional world, that have kind of extended that a little bit longer. So some doctors I see now will extend it to 4 weeks or even 6 weeks. But that's the conventional model. For people that have known Lyme in the brain, they call it neuroborreliosis. So this is usually done if they do a spinal tap on you and they identify Lyme in your spinal fluid. Then the recommendation is to give you IV antibiotics. Okay. So that's sort of the standard guideline. And even for pregnant women, there is a recommendation for antibiotics. But again, they kind of cap it off at that 3 weeks, and when you're done, you're done.
Can you explain the bit of a difference between the different types of antibiotics they use and what they're doing?
Yeah, so, antibiotics are really broken down into 2 types of categories. There's one that are called bactericidal, which means that these antibiotics directly kill the bug. And the other ones are called bacteriostatic. So they don't kill the bug. What they do is they stop the bug from replicating. And so the concept in those type of drugs is that, it holds it at bay and it gives your immune system the chance to go in there and get rid of it. So amoxicillin is a bactericidal. It actually it breaks up the cell wall of the bacteria, so it kills it directly. Where doxycycline, the more common drug, is a bacteriostatic. Again, it just keeps the organism from replicating. The challenge in this is that Lyme is a very slow-growing organism. So any antibiotic that's geared at affecting its replication is only going to work when the organism's in its replication cycle. Most bacteria replicate every 20 minutes. Lyme can replicate up to every 16 days. So it's very, very slow. And I think that's why we argue that the course of treatment really needs to be much longer, because it is such a slow-growing organism.
Wow. Okay. So now they've gotten this round of antibiotics, and then they're done and they're treated. What if they're not? What if they're still having symptoms? Do they now go into chronic Lyme?
Well,
what would a conventional treatment be for chronic Lyme?
Well, from a conventional standpoint, there is no treatment.
Okay.
I mean, if you go to the CDC's website and if you read what they call post-Lyme syndrome, it's basically symptomatic support, but they don't recommend antibiotics. Now, there's a group out there called ILADS, the International Lyme and Associated Disease Society, that feels very differently. And these doctors will use antibiotics long-term in people that have chronic Lyme or persistent Lyme. So that's where we kind of deviate from the Infectious Disease Society of America. This is the conventional infectious disease doctors that really don't believe in using antibiotics long-term like that. I would argue, I'm probably more along that line as well, that my experience for most patients with chronic Lyme is that they might do well on antibiotics temporarily, but when they come off the antibiotics, they often regress and relapse fairly quickly. And my concern with the long-term antibiotics is what it's doing to your own gut flora, your own microbiome, all of these healthy bacteria we need to function well. You can't kill the bad stuff without killing the good stuff. And as much as we try to support with probiotics and things like that, we're always going to kill off more than we can replenish, and that can become a bit of a problem. So, there's a lot of other alternatives out there to the antibiotics, but from a conventional standpoint, the antibiotics are really only for acute Lyme and are pretty much ignored for chronic Lyme.
Okay, so let's talk a little bit about what you would do for treatment if somebody's coming with these 90% of patients who are coming to you with chronic Lyme.
Yeah. So, for chronic Lyme, again, my observation is, really what the organism has done in triggering this autoimmune reaction in the body. So our goal is really to take the pressure off the immune system and start to quiet that response down. Autoimmunity, if you think about it, it's an over response of the immune system. Your immune system's reacting to something it shouldn't be reacting to. So we want to do things to start to retrain the immune system to stop overreacting. Imagine your body's treating Lyme like an allergen instead of a pathogen. So even if it's there at low levels, your immune system's having this over response to it. And it's not the antibodies that are directly killing the bug. These are the antibodies that are affecting your own tissue. So whether it's your gut, your joints, your brain, and so forth. So the way that I start is I start really with the fundamental gut stuff, and that starts with diet. And what I found over the years is that getting people on what we call an alkaline diet, and that means eating foods that help promote better pH balance in your body. So an alkaline pH is also what they call a basic pH. This is a pH higher than 7. And what we know is that your cells function optimally when it's in an alkaline state, with the exception of the stomach, the bladder, and the vaginal area in women that's very acidic. The rest of your body is actually very alkaline. So in a very basic way, I've got it in my book. We'll talk about it at the end of the podcast, but you can kind of think of eating mostly a vegetarian diet, with really keeping your meat sources and egg sources down to about 20% of your dietary intake. And then there's certain foods we really do try to have you remove just because they promote a lot of acid in the body. So that's dairy products. That pretty much includes all the junk food, processed foods. It also includes things like coffee. I was a big coffee drinker for years. I love coffee today, but I had to quit it because I would find that even small amounts would cause my neuropathy to flare up, even with just a couple of sips, and it just wasn't worth it. And so, I always get this from Lyme patients, who of course hate to change their diet, but well, how much can I have? Can I have just a little bit? And the truth is, everyone I'm sure has a different threshold, but for a lot of people, sometimes even a little bit goes a long way. So, kind of being diligent and what you're putting in your mouth can really make a big difference on how well your immune system functions.
Right. Well, a big part of our, we started this podcast back in December, and we really started just with the health stuff about the gut, because foundationally the gut is well, it's the foundation, right?
Well, and 80% of your immune system comes from the gut. So if the gut's not functioning well, your immune system's not going to function well.
And we learned, though, that a lot of people don't understand even what that means. Like, oh, just heal your gut. And people are like, what? How do I do that? What does that mean, right? And they may think they're eating fairly healthy. They may not even understand. So we've had to do some education and just sharing some information around what it means to have a healthy gut and to be digesting and absorbing your food, and making sure that you're not having any infection in the gut, or you're not having any allergen that's creating, leaky gut, and helping to heal that. Because I really think most people who are eating the standard American diet for their whole life, and the amount of stress that we live under today, that's different than maybe a hunter-gatherer stress, right? So when you're talking to, another big piece of our platform is nature and exposure to nature. And so a lot of people in our who are listening to us, they have that kind of covered. They prefer to be in nature. That's where they feel the best, but they may not be eating as healthy. And so maybe they go to nature and they can keep their stress down, but but they're still eating processed foods, and they're doing that. Or maybe they're eating really healthy meat, right? They're eating healthy game, but they're not eating enough vegetables, and they're not getting hydrated enough, and they're not having enough healthy fibers in their diet. And so really getting people to understand that what that means, having a foundationally healthy gut. And I think it just comes down to the basics is really having that more hunter-gatherer diet, where you're eating lean protein with more of the fibers and vegetables and densely nutrient foods, right?
Yeah, and I think it's interesting when I look at, meat as a whole, and you look at what it does to body pH, and the truth is I don't know the answer to this question, but I think we're looking at, conventionally raised animals, and I don't know that we can compare that with wild game. Deer and elk and, animals that are out foraging on their own. They're not in a pen. They're not force fed. I think, the chemical composition is very different. But, I've never really seen a comparison of, wild game to, conventionally raised. I imagine it probably is different, though.
Yeah, and it's a higher essential fatty acid and a lower saturated fat, but it still is a meat, and it's a protein. And again, you have to be able to break that that down to get your amino acids. Again, that whole process starting in the stomach and not having enough hydrochloric acid,
Right.
which in turn, hydrochloric acid kills things. That's the whole point of it, right? It's to break stuff down. It's also to kill the bacteria, to kill the fungus, to kill the viruses that are going into our body.
Right.
When we touch our face and we lick our fingers and we eat our food. And that's why we don't get food poisoning every single time we eat, right? Because really our stomach acid is that first line of defense.
Right.
And that we found so many people, right, are taking acid blockers. And so many people, that first barrier of defense is already shot.
Right.
And so their gut, getting deeper into the gut is getting more destroyed from and they're not absorbing and breaking down what they need. And so I think that is almost it seems like every treatment and everything that gut health is so important, but also understanding what that means. And then diet you can't do it without diet. Like people say, oh, can I just drink a drink? Can I just drink a protein? Can I just drink these vitamins? You can't. And especially if you're on protocols like for the Lyme disease, if maybe you've done the conventional antibiotics, all that, your gut your microbiome is going to be.
Well, and that's it too. I mean, a lot of people I've seen have been on antibiotics and sometimes for years. Well, antibiotics are going to make your body very acidic. Right. And so I think, again, that's part of what sort of, contradictory to what we're trying to achieve is that, it's sort of chemically working against you. And in the effort to try and kill the organism, again, how much damage is it doing to your fundamental physiology? Much like kind of taking the acid blockers, killing off the microbiome in your gut. These bacteria are there for a purpose. They protect us. They help us digest our food. They protect the gut barrier.
They produce vitamins for bone health and blood vessel health. And what else would you?
So after we, get through, the diet piece and looking at some other nutrients that, really help support gut health, and that really is kind of individual, whether they're more, constipated, loose stool, we look at their bowel function very well. And then the next step is really, I start getting into herbal therapy. Herbs can be very effective at killing Lyme, killing co-infection. And in the antibiotic world, you really kind of have to know what you're treating because the antibiotic regimen would change from organism to organism. So the way you treat Lyme might be a little different than Bartonella, which is different than Babesia, and so forth. What I like about a lot of the herbal protocols is they kind of kill all these organisms. I mean, whether it's Lyme or any of the co-infections or combinations, I mean, I've had good success of using these treatments where you don't necessarily have to tailor one from the other. So it does make it just a little bit more simple for people. And there's several different herbal protocols out there. If you go on the internet and read about it, there's, probably 6 or 7, pretty well-known herbal treatments. I've really found, just from my own experience and treating a lot of patients, there's 2 protocols I probably follow the most. The first protocol is a doctor out of New York City. His name's Dr. Zhang, Zhang. He's a Chinese medical doctor and works as an acupuncturist in New York City. But when I had Lyme disease and was coming off antibiotics, he's the guy I saw who really kind of pulled me out of the weeds and got me feeling well again. And his is a combination of traditional Chinese herbs. And so it's several different formulas. And again, I think it would be a little bit complex to try and describe all of them in detail for this podcast. But the basic summary of what he's trying to accomplish is the herbs really cover a broad depth of what Lyme does to the body. So, the infection is really the initial problem, but it's everything else that happens after that. And the way I like to think of it is like, if you're standing on the lake in the morning and it's a nice quiet lake and a motorboat goes blowing by, the boat can be long gone, but there's ripples in the wake,
Mm-hmm.
And that's kind of what Lyme does to the body is it just leaves a wake of destruction in its path. So that's what we're really trying to often, clean up. And so what I like about his herbs is that he does have a couple formulas that really go after Lyme and the co-infection to bring that load of the organism down. But he's got another formula to help boost your own immune system. He's got another formula that's anti-inflammatory. He's got another formula that helps promote circulation. So I think it really encompasses, the breadth of what Lyme's doing to the body.
Right, because even antibiotic use, it's like having a huge target and just pinpointing one little spot on that target, right? Like, okay, this is the bacteria, we're going to kill it, but we're not going to address anything else that happens in that wake. And the wake is really what's likely doing the most damage.
Right.
And that's where in. It's like it's so it's not looking at the whole picture. It's kind of that one thing, and then people are dealing with like. Can you talk a little bit about Herxheimer reactions? And so
Sure.
people who have done treatments may have heard of this. What this is, Herxheimer.
Yeah. So anytime you start any kind of Lyme treatment, and actually it's not unique to the Lyme, it can be with other types of infections as well, but it's called a Herxheimer reaction, or you read about herxing.
Yeah.
And what it is a die-off reaction. So as your immune system is trying to gear up to fight the infection starts to die off. Part of it's a combination of some of the toxins that can be released from the organism itself as it dies, and the other part is that you sort of get this, burst of what are called cytokines. These are parts of your immune system that are chemicals that go after the organism, but they can make you feel pretty horrible. And herxing is basically flu-like symptoms, so you can feel more tired, more achy, more brain fog, more lethargic. It tends to be somewhat transient for people. It can last anywhere from a few days, sometimes even up to a couple of weeks. Typically, if it happens, we don't stop treatment. That's a sign that whatever we're doing is actually working. So we want to kind of keep plowing ahead. And often when people get on the back end of that, they feel remarkably better.
Okay, so it's almost like the Lyme, you feel like you have really bad Lyme. It sounds like the Herx is like it's accentuating some symptoms really strongly,
It often
right?
is, yeah. Your symptoms just become, sometimes, significantly worse. Depending on the kind of treatment that you're doing. I mean, with antibiotics, herxing is far more common. With herbal therapy, it can happen. It's less common.
Mm-hmm.
So that's one of the advantages of herbal therapy as well, is you're just less likely to experience that. But I have some very sensitive patients, even with very small doses of herbs, they start to herx. It can happen just depending
Mm-hmm.
on the sensitivity level of the person. But it's not necessarily a bad thing.
So I think, what would you say to somebody who's listening right now and they're like, oh, great, he's not prescribing antibiotics, he's prescribing herbs. Like herbs don't work, they're not strong enough, they're not pharmaceutical. Like, what would you say to this idea of maybe helping people to understand the power of quote unquote herbs and what that means? Like,
well, I think you could probably start with just understand that a lot of conventional drugs came from herbs.
right.
I mean, the Dioxin, which is used for heart disease, came from digitalis. We have a very long history of a lot of chemicals or drugs. I mean, even statin drugs like Lipitor came from red yeast rice, came from a food. So, historically, a lot of things that are used in conventional medicine in some way were derived from herbs. And I think, people don't necessarily understand that herbs contain very powerful components that work in a lot of different ways for various illnesses. And in many cases, there's actually a lot of research. So, for example, Dr. Zhang has actually written a book about his herbal formulas and has lots of references on the antimicrobial effects of those herbs. So they've actually been very well studied. And I haven't discussed yet another protocol I use from Dr. Cowden, but Dr. Cowden's protocol, which is a series of tinctures, these are liquid extracts, and these herbs all come from the Amazon. There's actually a researcher at the University of New Haven named Dr. Eva Sappi, and she's been studying these herbs for some years now, and she actually did head-to-head comparisons with doxycycline and found that it worked better.
With less side effects, right?
With less side effects.
Right.
So, yeah, when I think people sometimes get very nervous when I prescribe herbs instead of antibiotics, and they worry, is it going to work? Well, actually, we've got both good clinical and research evidence that not only do they work as well, but in some cases even better with certainly less side effects.
Mm-hmm. Okay. Yeah, I think that's, I think in the alternative, no, I don't even like to use the word alternative. I think in our world, we know so much about plants and herbs and the background of even where medication pharmaceuticals come from. And so we are much more open to using these, but that I think a lot of the population has the idea that a drug is faster, quicker, safer, and it's going to create lasting results. Whereas they think of an herb maybe like, eating rosemary out of your backyard, and it's not really going to, taste good, or it's going to do, but it's not really it doesn't have a medicinal benefit. But really, herbs are kind of like food, right? And it's not like you eat, there may be certain foods. Well, I guess Americans kind of like we eat under like 30 foods. Like we don't have a very diverse diet, really. But if you look at cultures that even hunter-gatherer diets. It's a very diverse diet, and they're eating herbs and roots and fruits and vegetables and meats and things. And so you get more of that array, and herbs are a big piece of that. So herbs are really like food.
Right.
And you get the constituents of it all. Instead of like the statin drug, you get the statin. You don't get everything else that red yeast rice has that makes the statin maybe work at a lower force. It still works. It's just not, you don't have those side effects, right?
Yeah. Well, and I think, you have to acknowledge that, I mean, for example, Dr. Cowden's herbs that come from the Amazon, these are herbs that have been used by indigenous peoples for millennia.
Right.
So the one thing I would argue is that when you've got, cultures that use herbs for, hundreds or thousands of years, if something doesn't work, people figure it out. They stop using it.
Mm-hmm.
The fact that they continue to use it, they use it because it works. So the one thing we always never get in drug studies is really long-term data. And with many herbs, we actually have long-term, although not a typical research study, but long-term clinical use where certainly the safety's been evaluated because people take these herbs and they don't die and they don't get sick. So I think understanding the cultural background of where these herbs are used, the type of maladies that they've been used to treat, gives us a pretty good starting point of the clinical benefit of them. But as time has gone on, I think more and more research keeps coming out on the actual chemical composition of the herbs. We now know that many herbs we use have constituents that are biologically active in whatever area of the body. And so when I hear, "Oh, there's no research," I'm like, well, you haven't read anything because if you actually go and dig, you'll find actually quite a bit of research on most of the herbs that we use medicinally.
Mm-hmm. Okay, so if with the herbal treatments, they're in very specific formulations and dosages, and right. So it's a very dedicated program that you're putting on. What is the length of time for treatment per se in an average person? What are you looking at? Like, is it 10 days or is it 6 months? What would you say is your...
Well, for someone with acute Lyme disease, again, I start with at least 6 weeks of herbal treatment, and we just kind of, base it on how someone's feeling. So again, if someone's still, like if they tell me, look, I'm feeling better, but I'm not quite feeling completely well, we'll continue on their regimen.
Now, acutely, you'll use the herbs before antibiotics too, right?
Yes.
You will?
Absolutely.
Okay, for the acute cases.
Yeah. And with chronic Lyme, the herbal regimens, 3 to 6 months is very common. Again, sometimes I have people who do stay on longer. Again, we really base it on how somebody's responding to the treatment. And the one thing I like about the herbal protocols too is, if you start on a protocol and someone's not responding as well as you'd like, we can change it fairly easily. Mm-hmm. It's really kind of a function of what people can tolerate, what they take. Money, of course, is always an issue, but of course, insurance doesn't pay for any of this. And some of the herbal protocols are more expensive than others. But we've got a lot of different options, and I've found that all of them work for different people, and we just kind of have to find, what that right combination is for you.
A big question that I got from a number of people who have chronic Lyme is that question of expense, that they've been to 10 different doctors, they've had 10 different expensive treatments, they've even had these IV antibiotics, 6 months, 12 months. Insurance doesn't pay for any of it. They literally have no money left, and they're still sick.
Well, the nice thing, I guess, when you compare the cost of herbs relative to IV antibiotics, it's substantially cheaper.
Right.
But when you've exhausted your financial resources, everything's expensive.
Right.
But that's where, I'd rather, get people from the get-go on some of the herbal regimens. Doxycycline insurance pays for, but, depending on the state you're in, some states like Connecticut are protected, so doctors are actually allowed to prescribe for longer periods, and insurance will pay. In other states, you get your 21 days, and then you have to fight after that. And certainly IV antibiotics you have to fight for. So if people are paying out of pocket, especially IV antibiotics, that can get to be very expensive very quickly. But the herbs, realistically, depending on the protocol, it can run anywhere from $100 to $500 a month, depending on the protocol that you're using. So, my conversation with patients is, we always talk about the budget, and, if we have to start with whatever's going to be the cheapest, even though maybe it's not the most effective or the best, it's better than nothing. Mm-hmm. And then, depending on how their resources change, we can always adapt the regimen. But I like to be very realistic about what people can financially do, because often I get that situation where people have been to 10 doctors, exhausted their resources, still desperate for help, and now we're trying something new, and it's just another out-of-pocket expense. So it's unfortunate, but I think when you look at the overall cost of a lot of the type of natural therapies we're doing relative to the more expensive conventional ones, it does end up being a little bit cheaper.
Right. So what are some of the other foundational pieces that you use? So diet is a big one.
Yeah.
And the herbs obviously is a big piece of your treatment. What else are you counseling patients in to do?
So, of course, all of the lifestyle things that are important for maintaining, a good immune system and tissue repair. So sleep is one that I find is really paramount. And most of the Lyme patients I work with complain that they don't sleep well. That's the time when your body really gets to repair itself, restore. And if you're not getting enough hours of sleep and not good quality sleep, it's just hard for your body to heal. Right. So we talk a lot about, all the things that help promote better sleep pattern. I think one of the biggest problems I see now is, crawling into bed with your iPad or iPhone, and we now know I'm guilty of it too, but we're now seeing in the research.
How about crawling into bed with a 2-year-old who's kicking you in the head all night? Like this week, I've had 6 to 8 hours of sleep a night. Some nights more. Consistent sleep, not woken up by children. Wow.
What a difference.
Your mornings are so different. And think of all the millions of people who go to bed with their iPad, they're co-sleeping with their children, they have to get up early for their jobs, they didn't go to bed early enough, like they're woken up by infants. Like I feel like, and then it's just like chronically sleep deprived. Everybody's like sleep deprived.
Yeah, I think this is kind of a national epidemic, outside of Lyme disease. But, bad sleep, poor sleep is just associated with so many health issues. And you're right, between, kids and other external factors, stress, all of that feeds into how well you sleep. And sleep is actually kind of a very complex process. There's a lot of hormones and neurotransmitters involved, and you need everything to kind of be in sync to keep your sleep pattern regular. And look, it takes sometimes many, many months to get people back on a regular sleep pattern. It doesn't happen overnight, but it really takes a commitment of getting yourself on a schedule to promote better sleep. And it's so easy for things to derail that, and the kids are up and I got to do this. And so it's really trying to work with people to figure out how we can get a more consistent pattern. And sometimes we do use some nutrients and some herbs to help promote better sleep, but a lot of it I think is
what about sleep apnea?
Sleep apnea
is so big, getting people to get help with their sleep apnea.
Yeah. So, we just have to go through that process. What is it about your sleep that's keeping you from sleeping well? And whether, sleep apnea or other factors, once you kind of know what the problem is, it's easier to make good recommendations on how to treat it. But sleep, I see, is one of the biggest things that I think keeps Lyme people from getting well. Okay. And so if we can get them on really good sleep. And the second piece of this is really exercise. Okay. And I see a lot of Lyme patients, they're so exhausted to the bone. The thought of moving at all is just overwhelming, and it is. And so my philosophy is move when you can, where you can, how you can. And maybe it's just sitting on the floor stretching. Anything that's going to get your blood moving is going to help. A lot of Lyme patients, I can even tell when I draw their blood tends to come up very thick and viscous, which is a sign of inflammation. And so anything we can do to get that blood so it's not more like water than oil is going to be helpful. So I like really gentle exercises. So yoga or Tai Chi, Pilates, these kind of things can be very gentle, easy to adapt to your ability. But any kind of movement really, I think, is very beneficial for a lot of reasons. Better blood flow, better oxygen, bringing more nutrients to the right tissue. And so, move when you can and where you can.
Okay. And anything else?
Well, the last thing, that we've been doing the last few years in my practice that I think is very exciting is we've been doing a therapy called low-dose immunotherapy. And low-dose immunotherapy was developed by a medical doctor in Hawaii named Dr. Ty Vincent. And the concept is that it's a way of trying to modulate the immune response to Lyme or any of the co-infections. And it's basically using a homeopathic dilution of the organism that's been killed. We dilute it out and we mix it with an enzyme called beta-glucuronidase. We found that this enzyme actually churns off that immune reaction to whatever it's mixed with. So, we got it for Lyme, we've got it for Candida, we've got it for strep, we've got it for various organisms. But because of this autoimmune response that gets triggered, I find a lot of people who've been through numerous therapies, antibiotics, herbs, you name it, sometimes they have a very good response to this in a relatively short period of time. And what's nice about it too is that the doses are typically given every 7 to 8 weeks, and it's a fairly inexpensive therapy. So,
and is it an oral or is it an injection or what
it's
is it?
Sublingual. It goes under the tongue. So
okay.
yeah, we actually draw it up in a little syringe. It's 1 drop, and you just squirt it under the tongue. So it's it can be very, very powerful for some people. I mean, I've taken it myself and found it made a big difference. Probably 80% of the people I use it on have a positive response. The challenge with this therapy is the dose at which people respond, the range is really wide.
Right.
It's kind of like the difference between taking 1 milligram and 10,000 milligrams. I mean, it's that broad. So often, we have to find the right concentration that really helps you. If the concentration is too strong, it actually can cause a flare. It can cause like a Herc reaction.
Okay.
And people don't like that. So I've kind of learned clinically, I tend to start at a very low dilution, very weak, make sure you tolerate it, and then we can kind of work our way up as you tolerate it. That way we can find the right dose that works best for you without pushing you too far that you actually start to flare. But once we find that right dose, again, it's been very helpful for a lot of my Lyme patients.
Okay. Cool. And anything else? Probably a lot of stuff.
Well, there's a lot of other stuff. We've actually been using another thing called pulsed electromagnetic frequency.
It's interesting. You mentioned that in your talk yesterday, and I've had a device in my office because I hurt a disc in my low back during the birth process.
Yeah.
And I had pretty low back pain for the first year after birth. And I ordered this device from Germany. It's a pulse elect. It's not a beamer.
Not a beamer.
It's called an MRS 1000. But it was easy because it's a pad that I can lay on my massage table. It also has a pillow and like a probe thing.
Yep.
And I ordered it. I had to get it out of Canada. It was from Germany, and they were only at the time, they're now selling in the States, but they were only selling through Canada. And it's just a device that you lay on it, and the different pads have different frequencies, and it's a pulsed frequency. And I started using it. I would, when I would breastfeed or whatever, I'd lay on the pad with it, and then I'd use the probe and specific. You can't even feel it.
Nope.
You can't feel it at all. So most people were like, this doesn't even work. What is this? But the research in Germany and Japan, mainly Germany and Japan, have been using it forever. And, bone healing, tissue healing, that's what they're using it. Right. They use it in this country for scar, for surgery after surgery or bone surgeries. It brings in circulation. And so the Germans have been using it for years around neurological disease, Parkinson's disease, MS, fatigue, kind of these fatigue syndromes. And just really what it's doing is it's kind of, I just tell people simply, cleaning out the bad cells and helping your good cells kind of plump up and work better. But it's so subtle, and you do have to use it more consistently, right? Now, it depends. Some of these ones are stronger. So when you use them, the old ones used to sit on this thing and put your feet on the metal pad. Is that the beamer?
No,
and you hold this like ball, and it goes, and you're like, what is this crazy thing? But and that was the older model, but you could only do that for a couple minutes. It was so strong. Like you could only handle so much of that. So now they have this really, and it's packable. You can carry it. I used to have a practice in Montana. Yeah. I used to take it back and forth because then it helped me so much. I'd use it on my daughter for teething. And I said, why am I not using this in my clinic with my patients? So I just put it on my table, and patients come in and they lay down, and I'm doing my other therapies or we're talking, and I have it on, and it's helping them. And some people don't notice it, but some people do. And I noticed a lot. So when I saw that you were using PMFT for this, I was like, wow.
Yeah, and we've had some really good responses. People don't feel it. They feel generally very well afterwards, and they feel very relaxed. The whole concept of it is that you're putting in basically an energy that vibrates the same as your own cells. That's really what it's kind of doing. So, we get exposed to all these different frequencies, radio frequencies, electromagnetic frequencies that are very different than our own tissue. So this is a way of trying to help sort of counter and balance that. But yeah, what the Germans especially have shown is that it really helps with tissue repair and circulation, which is very appropriate for Lyme patients. And we had one woman who came in a wheelchair. She could walk, but it was very hard. She had one session on the PEMF, and then she got out and walked out on her own.
Yeah.
So it can be very profound for some people, but I like it because it's non-invasive, it doesn't hurt, and there's actually now, like what the company I work with, they make a personal one. So instead of you having to go to the doctor to have the treatment done, it's a little device that you can program, wear it around your neck or put in your pocket, and just carry it around with you all day.
That's great.
And it's just very
it's
convenient.
A lot. My device is not cheap. So
the personal device that this company makes, I think, is about $1,000.
That's still cheaper than
it's not cheap, but if it's something where you're going to the doctor for, it's saving you the doctor visits and that kind of thing. And I like the fact though that it's programmable, and so you can kind of change the protocols you want to do. And the reason I like this company is that I can actually write the protocol for my patient, email it to them, they can upload it to their device, and then now we've got them on the right protocol.
And I like to differentiate between, this is like not magnets. People think, oh, is this magnets? This is not magnets. This is a pulsed frequency that's in the device. It's pulsing a frequency that your cells, kind of the frequencies are the same, and it's helping your cells to heal. So it's not using magnets. I think people get kind of weirded out by that.
Yeah.
That's different. That's different, right?
They're completely different. And with PEMF, I think it's hard for people because you don't feel it.
Right.
It's like, well, what's it really doing? And it's just the nature of the signal that's being generated. But again, I think if people look in the research, they'll see it's been well studied, well documented. And again, we've had really good clinical results with it.
And the other question I have about, going back to the acid-base balance and the alkaline diet. Differentiating between the acid-base balance in the blood and in the tissues. Are those two different things? Is that different?
Well, they are. Every compartment in the body has a different pH.
Right.
The blood pH is very tightly regulated.
Right.
It only varies, about 0.2 in pH, and too high, too low, you're dead. So nothing in an alkaline diet is going to change blood pH. That's not really the purpose. It's really looking more at tissue pH, and that's a little bit harder to measure. And it was actually very interesting when I wrote the book because there's actually very few articles. As long as pH diet's been out there, there's actually only a handful of articles that have really studied it. But in those few articles, they were all very positive studies and showed that there was a lot of health benefits to follow.
Yeah, I've heard some more conventional people poo-poo the whole alkaline thing, and I think that they're not differentiating for people between blood alkalinity, tissue alkalinity. Of course, if your blood gets too acidic, you're dead, and if it gets too alkaline, you're dead. We know that as physicians, right? So we're talking more about that kind of tissue health and just keeping so that you're not getting tons of inflammation and acidic types of things in the tissues, right? And differentiating between that. So I think that's maybe even too where there's just not a ton of conventional research done on this because it may be even hard to test. The parameters seem like it would be more difficult to do. But clinically, we do see improvement when people change their diet to a more alkaline-based, nutrient-rich diet, which most of those, like we said, hunter-gatherer diets are more alkaline in general. So we see people get better when that happens. So we know that there's a pH change within the cells.
Well, I think anyone could argue that if you change your diet and you're eating a lot of processed foods and now you're eating, organic, healthy food, you're going to feel better. I'm sure that's true for everybody. But again, I think when you go back and look at the chemistry, one of the things that happens when you eat a lot of processed foods, again, the byproduct of eating those foods is acid production in the body. And so what we're really doing is we're countering that acid buildup because that acid buildup does promote inflammation through more complex biochemical pathways. But there is a chemical understanding of why this is happening in the body. But yeah, really ultimately what we're trying to do is address, that tissue pH, because that's where a lot of the action happens. But yeah, blood pH really doesn't change.
Okay. So besides, talking at events like this, and I'm guessing you do tons of public appearances within the medical community and outside of the medical community, what would you see as the greater goal for helping people with Lyme disease in the medical community? What do you think that we can offer that we're not offering?
Well, my goal, and certainly talking to other physicians, other healthcare providers, is really just trying to promote better awareness that Lyme is much more common than you probably were taught, and really educating them on how to, read labs and understand, what are you really diagnosing, and again, understanding that Lyme is a clinical diagnosis. So, a negative test does not exclude the possibility of having Lyme disease, and that you kind of have to go through this, process of, ruling out other things. But if you've got a patient sitting in front of you that has all these signs and symptoms, and you've ruled everything else out, then there's evidence on paper, especially if there's Lyme exposure, that it's very appropriate to treat. And from the patient standpoint, if you think you might have Lyme and you've been to your doctor and they kind of poo-poo you, and they tested you and you had a negative test and they said you don't have Lyme, stop worrying about it. You need to get in the hands of someone who understands Lyme. Right. And there are fortunately many doctors around the country who have a better understanding of Lyme disease and are more likely to get you the right test to at least better help identify if that's what's going on.
Now, you obviously can work with anybody anywhere, right?
Yeah, I have people come from all over the country, all over the world. So like I said, I've got offices in Connecticut and California.
So where in Connecticut are you?
I'm in Fairfield, Connecticut. So I'm about an hour outside of New York City. Okay.
And then where in California?
I'm in Orange County, California, and Irvine.
Okay, nice. So, Darin, what's your website? How can people get a hold of you?
Sure. So my website is dariningelsnd.com. That's DARININGELSND, N as in Nancy, D.com.
Okay. And are you part of an association, or I know there's like the ELADS Association, you talked about others. Are you a part of a group of doctors that is using some of these same therapies that you are, or are you kind of the...
Well, I think a lot of doctors that are treating Lyme, most of the doctors that are I'm a member of ILADS as well.
Okay.
Most of the doctors in that organization probably tend to use antibiotics more than herbal therapy. There are other members, though, who are using a lot of the same protocols that I'm using. So certainly through ILADS, you can find a practitioner. You can also find practitioners through the naturopathic organization, naturopathic.org, to find a naturopath, at least in the United States. There are a lot of Lyme doctors in the American Academy of Environmental Medicine, and their website is aaemonline.org. Okay. So between those three organizations, you can probably find someone in your area who really understands Lyme disease and can really help you get good testing and treatment.
Now, we have listeners in Canada, we have listeners in New Zealand, we have listeners in Australia, we probably have a few listeners in Europe. What would you say to the people that are living outside of the States about possibly what either their laws are or even their relationship with Lyme disease would be medically?
Well, Australia, for example, I have worked with several Australians, and the Australian government says that Lyme disease doesn't exist. So if you're an Aussie, you're going to have a hard time. I know several of the Aussies have sent their samples to the United States to get tested. They get it drawn in Australia, send it to IGNX in California to get the diagnosis. But a lot of the doctors in Australia have been, prosecuted for treating Lyme disease. So depending on, I guess, what country you're in. In Europe, I know there's a bit of resistance. Canada, I think, is a lot like the United States. They tend to follow more of the CDC guidelines on Lyme, but there are a lot of Lyme literate doctors in Canada as well. So I think it really is just, search your local community. If you see if you can find someone, and if you can't, there are a lot of doctors like myself that do work remotely. If that's an option for you, it's better to have somebody than nobody. But I think it's always best if you can find someone in your local area that can help manage you.
Okay, so you have a book coming out next April? When is your book coming out?
Okay. Yeah, so I have a book coming out called The Lyme Solution, and it's slated to be released in early April of 2018.
Okay.
So if you go onto my website and if you sign up for my email list, we are going to send a notice out when the pre-orders are available. and I have not been notified by the publisher yet when that's going to happen. But if you want to sign up, we also have a free ebook that you can download on some of my favorite immune boosting recipes. But if you get on our list, then we'll make sure to send an announcement out when the book's ready for pre-order.
Okay. Well, is there anything you want to add that I didn't ask?
Well, I just want to sort of encourage people out there who've been dealing with this, or again, if they've been struggling with these issues and they haven't had a definitive diagnosis, you kind of have to be the squeaky wheel. And I know a lot of people who live in areas where they get a lot of resistance from their local doctor and practitioner, and they're just desperate to find answers. I just met with a woman in Florida because she lives in Florida that's not known to be an endemic area, and she's a healthcare provider, and she couldn't get anybody to help her. So sure enough, I ran a test. I sent a test kit down to her. Her local doctor drew her. She tested positive, CDC positive to Lyme. She also has Babesia and Bartonella. And I'm like, well, this is why you feel terrible. And she just couldn't get anybody to help her. So be the squeaky wheel and keep finding people who will help you, because, the sooner you can get on any treatment, the better you're going to feel.
Right. And for those of you who do not have Lyme disease, take precautions.
Yes,
right?
Absolutely. Protect yourself, protect your family, check your dogs, check your children when they're outside, especially if you're in areas where you're concerned about ticks. And a little prevention goes a long way.
Right. That's the basis of our medicine, isn't it?
I think so.
Prevention. So, Darin, I thank you for doing this for us. I think this is going to give us, our listeners just went crazy when we said we were going to talk Lyme disease. So we may have some questions come up in the future. So who knows? Maybe we'll have you on again. But
Wonderful.
I appreciate you doing this for us. And anybody out there, if you want to get more information about what's going on with you, or you just have questions, or you want to work with a doctor like Dr. Ingels, please get a hold of him and let him see what he can do for you. So cool. Okay. Have a great rest of the convention.
All right. Great. Thanks,
okay,
Hillary.
Thanks.
Okay.
Hey folks, thanks for listening to the Hunt Harvest Health podcast. If you enjoyed the podcast, please leave us a review on iTunes or Stitcher. Visit our website at huntharvesthealth.com for more podcast stories and recipes. Follow us on Facebook and Instagram at Hunt Harvest Health. You can also message me at Sthealthy Hunter, that's STH, and I will be more than happy to answer any questions you might have. Also tag your photos Hunt Harvest Health or Get Sthealthy, as we enjoy seeing what you guys are doing as well.